we are switching to a new system. I know everybody is happy about that. This is called Imagetrend Elite. The username is your first initial and your last name. Your initial password will be 99 and your shield number. After that, you'll be prompted to make a new password, which you can make anything you want. You will find the privacy notice. Every time you log in, you will click yes. The first page that comes up is announcements. As of now, I have not posted any announcements for anyone. In order to start, you go into the Incidents tab on the top of the dashboard, and you will look for Elite Field Login. We'll click there. You will then have to log in again to access the field version of the actual PCRs. Whenever you log in, it will sync. That means it's downloading all the information it needs to run, all the past patients and anything else. Right, over here, you will put in a crew. Doesn't matter who logs in, anybody can be on the crew. One thing you have to remember too is to remove each person each time. Otherwise, no matter who signs in, whoever signs in on that tablet, they will always be logged in. So in order to add, you click add, you put in the crew member, and you state their role. The roles here could be multiple, so you can have somebody drive to the scene but be the primary caregiver. So you have to make sure to click both of them. You will do unit, you will log in, and then you have to put BLS and BLS unless you are going out as ALS. We'll then do the shift. Medical devices are only for ALS at this time. It's if you're taking out one of the life packs. To start a new call, you will click New Incident. This box will pop up each time just to confirm that these are the members of the crew you want on this call. Click Yes, and the call opens up. Over here, you'll have a run number. You do the crew, who's on the crew, the level, just like we would normally do. Then you have dispatch info, and these are the tabs you use, and it is simpler than the rest. If you go into not assessment, under patient info, you go to complaints, you click add complaint, and you write whatever the complaint is. The duration of complaint, it's whatever it is. And click OK, and when you hit the arrived at, it will automatically populate the date or time of onset depending on if you did the duration. When doing the assessment, you can use this tab. It has some basic things. On the right side over here, you have the power tools. Over here, you have Jotpad, which allows you to write notes if you need to write notes. And then you have more power tools. Over here, the assessment and exam are better to use than over here, as it populates a lot more. You can do skin, CTC, lung sounds, which is not available going through the actual assessment. It will be over here in the power tools. Also for medications and procedures, depending if you're ALS or BLS, it will medications will only give you choices of these medications. For procedures, which is procs, is certain things that you can do as the BLS provider, which is actually a big list. PQRST is part of assessment. Down here it says validation. This will tell you what you're missing. Right now, I have a score of negative 15 out of 100 due to some of the things that I put in. Depending what you put in, it will go step by step when you need to know what's going on. So now, as of now, I have no patient info. I have nothing going on. So I have to fill out all these wrongs. Over here we have transport. There's the narrative, signatures. Billing is where you're going to put in the insurance information. EMX exposure is if you've been exposed to any unsavory items. Power tools, it's a link to the power tools. Once you are done with the call, once everything is complete, you'll click save, and it will automatically save it and upload it. After you click save, you should also click post. It will allow you to be able to make sure it's finished. And once that's done, you could go on to the next call. And all you have to do is re-click New Incident.